and they use a little bit too much of the center abs, those rectus abdominis abs, instead of those deeper abs, and so they don't get the expansion through the rib cage that they're looking for, and they kind of defeat the whole purpose of the exercise. Greg Chaplin here, physical therapist and strength conditioning specialist. In this video, I'm going to go through the all fours belly lift exercise. I'm going to show you the most common mistake that I see, and then I'll talk you through the cues that I use. So without further ado, let's jump right in. So the all fours belly lift exercise looks a lot like the cat stretch in yoga, where you're pushing the rib cage away from the ground, and some of the benefits are going to be you'll improve flexibility of some of the back muscles, you'll improve expansion throughout the rib cage, and you'll improve the ability to recruit the deeper abdominals such as the obliques and the transverse abdominis. So the most common mistake that I see is when people perform this activity, instead of getting a uniform push of the rib cage, they actually just hinge up at one segment of the lower rib cage, and they use a little bit too much of the center abs, those rectus abdominis abs, instead of those deeper abs, and so they don't get the expansion through the rib cage that they're looking for, and they kind of defeat the whole purpose of the exercise. So let's go through what that will look like, and then I'll show you the cues that I use instead. So a lot of people round up kind of maximally through the rib cage, but because they don't have the ability to expand in the upper aspect of the rib cage between the shoulder blades, you'll see this kind of hinged appearance at the lower rib cage. And this usually indicates that you have a sternum that's tucking under as well. So the sternum and pubic bone are often coming together, meaning that we have increased activity of the rectus abdominis, which is going to reduce the ability of us to expand through the rib cage, because the sternum, which is like that center bone of the rib cage, is not really going to be able to effectively move under these circumstances. So when someone goes to breathe in this position, yes, they'll get a little bit of a feeling of expansion in the lower aspect of the rib cage, but often you're actually not going to get much movement compared to what you will when I show you the cues that I will use because of that position of the sternum. The other thing that's a little bit wrong with this position is a lot of people will tuck their butt under and they'll squeeze the backside of the pelvis, which will reduce the ability of the backside of the pelvis to expand as well, and will reduce the shape change that would be associated with doing this exercise the way that I'll show you in a second. The way that I like to do this exercise is first to just relax on both sides. So you could actually do kind of like a cat and camel sort of positioning until you find a comfortable place where you're not using too many superficial muscles on the front side of the body, especially in through that rectus abdominis region. Then from here, you're going to think about a nice uniform push through the floor. So you're really reaching through the floor. And what you'll see here is we don't get a dramatic curve in through the rib cage, but the curve that we do get is very gradual and includes that uppermost portion of the rib cage as well. So you can kind of think of this as you reach through the floor, the uppermost part of the rib cage also comes up between the shoulder blades, and you might even get a slight stretch in through that area of the shoulder blade as well. So from this position, you can inhale as you reach through the ground, and then as you continue to reach through the ground, you're going to exhale for a long time, usually through an open, relaxed mouth. When this happens, you should feel the ribs coming together from a lateral position towards a little bit closer together, coming in from the sides. And then in this new position, you're going to inhale, feeling the sternum slightly move towards the ground as the rib cage moves back. And then again, you'll exhale as you continue to reach. And you'll do one more breath, inhaling as you reach through the ground. Thinking about moving that sternum straight up and away from the ground, and then you'll inhale in the new position, allowing the sternum to move down as the rib cage continues to move away from the ground. Okay, folks, there you have it. So to recap,
let's try not to push up at just one particular segment of the rib cage. Let's instead try to move the whole rib cage back away from the ground. Let's keep those center abdominals relaxed so that the sternum is allowed to move. That's going to maximize the ability to recruit the deeper abs, to expand the back of the rib cage in a uniform fashion, and to keep that rib cage mobile by not stifling the movement of the sternum. So thanks a lot for watching. If you have any questions, throw them down in the comments. If you haven't already, subscribe to the channel, hit the notification bell so you'll know when I upload a new video. And until next time, thanks a lot for watching. Peace.